You are tuned into the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, M.D., M.B.A. The purpose of this show is to help mitigate health disparities, improving literacy related to health, economics, and education. For all your professional development, professional management, and educational support services needs, contact Test Taking Solution, where we're igniting success. Located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Literacy is knowledge and knowledge is power. Thank you for joining the Literacy Hour. Well, good morning, everyone, and welcome to another episode of the Literacy Hour. Today is January 13th, 2026. Yes, we have made it to a new year and I'm mighty glad about it. My heart and mind have just been on the Armstrong family for so long. And man, it just feels so good to hear Brother Larry Armstrong back in the house. He is holding it down. I love how he just brings us into worship service. He ushers us on in. And boy, we just have a great morning listening to WMPR 90.1 FM. Listen, I'm your host, Dr. Liddell, and this is the Literacy Hour. I'd love to hear from you. So feel free to call 601 714 8378. We know that many of you are joining us by way of our YouTube channel, and we do appreciate that. Thank you so much. Also, you're listening in on various radio stations around the state. Thank you as well. And man, just thanks for being engaged. You guys really do encourage us over at Test Taking Solution, where we're igniting success, enhancing literacy, and mitigating health disparities. Listen, if you're shy and you just want to message me while I'm on the air, go ahead and text it to me. You're good at that. If I receive it, you know that I will acknowledge it publicly on air, as I usually do, without calling your name. Now, if you want to share your name, call in 601-714-TEST. That's 601-714-8378. We sincerely thank our underwriters. And if you would like to help keep the Literacy Hour on the air, I would really appreciate if you would support that effort. You can either call the radio stations and tell them what your desires are, or you can give us a call again. Same number. The call-in number is 601-714-8378. I'll continue to volunteer my time hosting, and I want you to help keep this resource on the air. I want to start out with a few announcements, even though today is Second Tuesday when we focus on health literacy. Let's start with a few announcements. Let me see. Oh, yes. The one that I am just overjoyed about is the Building Healthy Relationship classes. You heard that right. Building Healthy Relationship classes. They're underway over at St. Matthew M.B.A. Church, 3660 Fontaine Avenue in Jackson, Mississippi. The first Testing, testing, 1, 2. All right, technology is great until it's not. Listen, okay, looks like I'm getting a thumbs up from the team here. All right, thank you so very much. I don't know how much you all heard while the mic was not acting right, but I will just say this, okay? The Building Healthy Relationship classes are underway over at St. Matthew M.B. Church. That's 3660 Fontaine Avenue, and I did tell you what I experienced. Listen, Reverend Dr. Collins, a wonderful small group facilitator, and I told you that he challenged everybody in attendance to first reflect on who we are as a person and what we want out of a relationship. He even asked us to define a healthy relationship, what that looks like to you. And the first word many people shared was respect in all of its various forms, respectful, I feel respected. So, respect, of course, trust, supportive, and other positive descriptors were thrown out. And then we explored aspects of an unhealthy relationship. And during that time, we heard words like control and demeaning, calling your partner or significant other out of his or her name. If you're doing that, please stop it this year and make that your New Year's resolution. Words hurt. What they say, sticks and stones may break my bones, but words will never hurt me. Man, that's not true. Being demeaning to your partner or significant other is very hurtful. Dishonesty was also used to describe unhealthy relationships, lack of trust, lack of intimacy. Yeah. So at the end of the class, the participants' evaluations were off the chart. They rated the instructor and the class a 10 out of 10. Now, hardly anything gets a perfect rating, right? Well, in this case, I concur. I don't think it could have been done any better. The next class will be held right there at the church on January 26th, starting at 6 p.m. If you cannot attend in person, which is the preferred method, you might be able to just call in. So give us a call over at Test Taking Solution 601-714-8378, and we'll connect you with that wonderful resource. Building Healthy Relationships. That class is being sponsored by St. Matthew MB Church. Man, St. Matthew's been doing so many things in and for the community here lately. Listen, they're having a clothing giveaway. Yeah, a clothing drive. Saturday, January 24th. Go ahead and mark your calendars from 12 noon to 3 p.m. in the back parking lot. You'll be able to get your hands on some great clothes and shoes and who knows what else. That's just how St. Matthew does it. So I'm excited about that, and um, I hope to be able to assist on that day. That's going to be a fun day. Lots is going on at St. Matthew. Relationship classes on site on second and fourth Mondays, Bible study on site on Tuesdays, Bible study by phone conference on Wednesdays. I attend by phone conference and I'm addicted, okay, to the teachings, that is. The best addiction to have, I think, is to be addicted to God's word. If your church or organization is doing something wonderful to help uplift others in the community, I want you to let me know about the resource and we'll share it right here on the Literacy Hour. There's another resource I want to let you in on, Biocrete. Biocrete Sustainable Construction. Yeah, they're having a job fair at the Jackson Medical Mall this morning from 9:30 until 12:30 in the community room. That's 350 West Woodrow Wilson Avenue. Biocrete. Biocrete. So instead of concrete, it's Biocrete. Okay. They're going to have a job fair as well tomorrow at the Metro Center. You heard me right. The Metro Center coming back online, everyone. 11 a.m. to 1 p.m. at the main entrance over at the Metro. And the next day, Thursday, January 15th, they're having a job fair at Hines Community College, the Medgar Evers campus. from 9:30 in the morning to 12:30 in the afternoon. Visit their website. It's biocreteglobal.com. And for those of you who are joining us by way of our YouTube channel, we have their website up on the screen right now. Biocrete Global. And I had never heard of Biocrete Global. And so if you're like me, you wanted to learn more about them, right? So visit their website. I did. You'll watch a video there. It's on their homepage. It's about EF Block. And I'm confident that when you review it, you'll be inspired and happy about Biocrete's mission. Looks like they're headquartered in the ATL, yes, Atlanta, but now they're here in our beautiful state of Mississippi, the capital city of Jackson. In the words of our mayor, John Horn, I see Jackson rising. All right, on to our local school districts, those in our listening area, and what's going on with the Jackson Public School District. January 14th, that's tomorrow. Look forward to your children bringing home their second term report cards. We cannot wait. And so that's tomorrow. Someone called me after the show last week and said, "Hey, Dr. Liddell, when are those report cards coming out?" And I want you to know tomorrow is the day. So look forward to your child bringing the report cards home. Report cards are important. They let you know how your child is progressing in his or her classes. And so you can't really get to where you're going unless you know where you are. And then take some steps, some effective steps, some proven steps, some strategic plans in order to get over to where you're trying to go, to reach your goals, right? So let's see where the students are tomorrow. And then let's begin to work, if they need it, to get them where they're trying to go. All right, get them those grades they want. No school on January 16th due to Teacher Professional Development Day, and there's no school January 19th due to Reverend Dr. Martin Luther King Jr.'s Day. It's a day of service. January 27th, there'll be Teacher Professional Development Day. That means that it's an 80% day for the students. They get out early. That's the Jackson Public School District announcements. Now, Hinds County School District got that special call board meeting January 15th from 1 to 4 p.m. And their school board meeting will be held January 16th from 5 to 7:30 p.m. Hey team, go ahead and put that on my calendar. Listen, I just love sitting up in their board meetings, man. They're run so well. I feel like I'm in Congress. They get so much done, and it's just a sight to behold. I enjoy attending the Hinds County School District's board meetings. No school there with the Hinds County School District January 20th due to Reverend Dr. Martin Luther King Jr.'s Day. So as you can see, some folks are out on the 19th, and the Hinds County School District is out on January 20th. School board work session on January 30th from 10 in the morning until 3 in the afternoon. And on January 31st, they have another special call board meeting. That's going to take place from 1 to 3 p.m. The Hattiesburg School District report cards will be issued today. So for those of you parents in the Hattiesburg School District, our WGDQ listening audience, yes, where God did it quickly. We want you to know that the report cards will be issued January 13th. January 19th, no school for Martin Luther King Day. And that's in the Hattiesburg school area. Listen, on Saturday, April 18th, go ahead and mark your calendars because ASGN, that's the Association of South Jackson Neighborhoods, is having its annual parade. Yes, the parade is going to begin at 9 a.m., Little Caesars parking lot, McDowell Road, and will end at Cardoza Middle School. Vendor setup begins at 7 o'clock at the Cardoza Middle School. Festivities and Fun Zone is going to be at the Cardoza Middle School. You know where it is, 3180 McDowell Road Extension. Jackson, Mississippi. There'll be vendors, bands, dance and cheer groups. Everyone's welcome. Go ahead and give Brother Ernest Ward a call, 601 201 3020. Or you can call Brother Johnny Bird. That's 601 720 9965. It's Health Literacy Tuesday here on the Literacy Hour, and I am your host, Dr. Kentrell Liddell, the CEO of Test Taking Solution and the founding president of our nonprofit arm, the Test Taking Solution Foundation. Want you to follow us on Facebook and Instagram to keep up with what's going on at TTS. Our handle on both of those social media platforms is TT Solution LLC. Again, for those of you joining us by way of our YouTube channel, you should see that on the screen. That's Facebook and Instagram. All right. So when you get over there, I want you to click those follow buttons, and that way you'll stay informed on what's going on at TTS. Also, please consider sponsoring a child to attend our after school program and our upcoming summer academic enrichment program. You can learn more about both of those by visiting our website. That's www.ttsfoundation.org. Oh, thank you so much for the encouragement. That's awesome. I'm glad you're listening in. Thank you all for listening to the Literacy Hour. Just be reminded the information shared during the Literacy Hour, either by the host or guest, is for educational purposes, and it does not constitute medical, legal, financial, or tax advice. For specific advice applicable to your situation, I want you to contact a licensed certified professional, preferably one with whom you have a relationship. Because remember, relationships really do matter. Thank you for joining me again this morning. The phone line is open, and I welcome your questions and comments. 601 714 8378. Don't forget, visit our website when you get a chance. It's TTS, like Tango Salute, foundation.org. If you go there right now and click on the Literacy Hour page, you'll find the link to our live stream. Just scroll down until you see the Literacy Hour YouTube channel. It's a link. Just click it, and you'll be able to go back and listen to any part of the show that you'd like. But don't just click it, subscribe to it. And that way you'll be notified whenever we're on air. Today, on this second Tuesday, we focus on health literacy. And just what is that? Well, it's the degree to which we all have the ability to find information, to understand information, and to use information and services. For what purpose? Well, to inform our health related decisions. So we can go out there and Google stuff, find the information, but do we understand what we just found? And do you understand that medical lingo? You won't be able to use it if you don't understand it. That's what being health literate is all about. It helps to inform the decisions we make about our own health care and the actions that we take for ourselves and for those who are entrusted to our care. So we want to help improve, help enhance our literacy. And that's our foundation's mission. And I think we're doing a mighty good job, if I do say so myself. But I don't want to be the only one saying it. I want you also chiming in. Our call-in number 601 714 8378. You can call in, talk to me, just let me know how we're doing. In the meantime, I want to share with you common pain relievers that they may raise heart disease and stroke risks. That's what the researchers have found. That's what some doctors are warning us about. Just this past week, we found that and settled in on the fact that there are some common over-the-counter pain medications. Caller, try calling back in again. I see where you called, but then for whatever reason, your call got dropped. So why don't you call back in and we will take your call. Hopefully, you're going to share something very helpful with us, something educational. and have details and facts to back it up. Yeah, common pain relievers, they may raise heart disease and stroke risk. And many might assume that over the counter meds are generally safer than stronger prescription drugs. But the research is out and it shows that they can still present risk. So I want you to be careful about those non-steroidal anti-inflammatory drugs you're going to the store and purchasing over the counter, those that are used to reduce pain and fever and inflammation. They've been pinpointed as the class of medicines most linked to elevated cardiovascular risk. Yeah, risk of high blood pressure, stroke, and heart attacks. There's an anesthesiologist at UNC Health in North Carolina who was interviewed earlier this week by Fox News. And her name is Miriam Joswa. And she said this is because they reduce the production of certain chemicals. And those chemicals, you all, are called prostaglandins, but you don't necessarily have to know that part. I just want you to be aware that there is a mechanism of action. All right, caller, you're on the air. What's your question or comment this morning? Go ahead and turn your radio down.
Sorry about that. Let me turn this down. Okay, cool. Hey, Dr. Liddell, this is Michael. Just listening to you. I didn't have a question. Most of just wanted to let you know that on today, I'm going to have my cousin, Dr. Jerry Smartin. We're going to be talking about seizures, what causes seizures, and how long the brain goes before damage is set in. And thank you for taking my call. It's always great to listen to you. Thank you so much, man.
Oh, awesome. Thank you so much, Brother Michael. Listen, let everybody know what time that's going to be in the name of the show, sir.
I will, Dr. Liddell. Okay, cool. That's at 6. Dr. Frank McKinnon's Health and Prosperity Show today at 6 p.m. And please tune in. Call in number 601-948-5950. Thank you so much, Dr. Liddell.
You're most welcome, Brother Michael. Thank you. So good to hear your voice. Listen, man, that's one of my heroes right there. And I'm so glad he called in to share with everyone that they'll be talking about seizures this evening. Listen in on that show. That's the Dr. Frank McCune Health and Prosperity Show host. And it's good. So you want to listen into that. All right. So this new health warning is being issued, and it's a popular issue. It's all over the web right about now, talking about these over the counter meds. They can lead to high blood pressure, heart attack, and stroke. Probably the other mechanism of action is that it's causing people to retain fluid and to retain salt. That fluid retention, that salt retention. As a matter of fact, that anesthesiologist agreed, as well as a cardiologist who was interviewed. And I'm just so happy they put it out there. All of that fluid retention, it increases volume. It puts a strain on the heart. It raises blood pressure. So common examples of NSAIDs, which is non-steroidal anti-inflammatory drugs. That's what NSAIDs stands for. So if you hear your doctor, nurse practitioner, or other mid-level provider talking about NSAIDs, that's what they're talking about. Drugs like ibuprofen, naproxen, aspirin, diclofenac, indomethacin, and celecoxib. Yeah, Celebrex. So the drugs have a generic name, you all, and they have a brand name. That brand name is what you see, when you first get to that shelf and you look at that bottle. It's that big name that's on the bottle. That's the brand name. Advil, for example. That's the brand name. But the generic is ibuprofen. Just turn that bottle around and you'll see the ingredient. It's going to say ibuprofen. And then look at the dosage, just how much ibuprofen, 200 milligrams, 400 milligrams, what is the dosage? That's important to know. So Some people say, oh, that off brand medicine doesn't work. Listen, it has that same ingredient in it. If the same dosage, they pretty much going to do the same thing. So, ibuprofen, aspirin, those medications, those are generic names. All right. Randomized trials have found that ibuprofen caused the biggest spike in blood pressure, followed by naproxen and then celecoxib. In general, the increase in blood pressure is more likely due to the higher doses and the longer duration of treatment. And that's what the associate professor over at the Department of Anesthesiology, still at that School of Medicine, North Carolina, said. They've been doing the research and they are sharing it with us, and I'm sharing it with you here on the Literacy Hour. What's the take home? NSAIDs, non-steroidals, over-the-counter pain medicines can increase stroke risk, can increase your cardiovascular heart risk, especially at high doses, especially with long-term use. Yeah, that's what I want you to know today. And when we learn better, we now have an opportunity to what? Do better. They found that the cardiovascular risk is generally higher for people 75 and older. So if you're elderly and you're in that age bracket, be careful. Be careful. Talk with your doctor. Talk with your doctor. And that is why I stress having a medical home. My favorite medical homes, federally qualified health centers. Yeah. And there are a lot of other independent clinics out here, and I'm sure some of them are really good. But you want to go to a place that's a one stop shop. And man, at a federally qualified health center, you can get so many things done and taken care of, from general health care, pediatric care, obstetrician, gynecology, women's health, men's health, pharmacies, vision care, glasses. I mean, all kinds of things, you okay? And right there in the one place. And so that's why I'm such a proponent of federally qualified health centers. I was so honored to work at Jackson Hines Comprehensive Health Center as a resident doctor. Yeah, over at UMC. And then following my residency, I don't know why I didn't think to apply for a full-time job over there, and they didn't recruit me either. So I'm not sure. You know how things just fall through the cracks. We had an awesome time there during residency, but we all get so busy and things happen. But later on in life, I would go back, and I was their quality manager for about a year and a half until I found it as Taking Solution. And now I'm out here helping our community in an even bigger way. Who knows? One day I might land right back at a federally qualified health center. It certainly would be an honor to do so. Now, what did you just hear from me? That age amplifies the risk. hmm And that's largely based on the cardiovascular risk that already increases as we age. Yeah, our kidney function reserve tends to decline as well. So you got your kidney function declining as you age. You got your cardiovascular risk increasing as you age. So please don't then go dump over the counter medications, especially these non steroidal anti inflammatory drugs, on top of that. They can destabilize the blood pressure control. All right. Talk with your doctor. If you're experiencing chest pain, shortness of breath, sudden weakness, numbness, severe headache, confusion, slurred speech, any vision changes, get to the doctor immediately. All right. And if your doctor won't see you or can't see you at that time, head straight to the ER. That's what they're there for. Okay. So that's enough about that. I just really wanted you to be aware this morning of the warning that has been issued about the over the counter pain medications. Also, there is new nutrition guidelines that have been made public as of January 7th. Yes, caller, you're on the air.
Good morning. Thank you.
Oh, yes. Good morning. Is this the representative, the gentleman with BioCrete?
Yes, it is.
Oh, wow. It's such an honor to have you on this morning. I spoke about your company earlier doing the show. I don't know if you got a chance to hear what I've already shared, but why don't you share with us what you'd like to at this time?
Well, thank you so much. It's a privilege to be invited to speak this morning. Yes, we're on a mission to bring some quality and good high paying jobs in any manner of stretch through Jackson, Mississippi. And we're excited about the process. We're excited about the opportunities. And we're just really, like I said, into it with all that we have to make sure that it's very professional, it's done in excellence, and that people can get the true benefits of what we're trying to accomplish here.
And I heard that it's going to be about what, 200 job openings? Is that correct?
That is correct. We have four slots of 50. And how we would run our business model, we need four slots of 50 participants, candidates, good associates, or we call it team members. And so we will be building that rapidly, as a matter of fact. And it is 200 jobs, and we will be multifaceted. Yes.
Well, I told everyone about the job fair you're having this morning over at the Jackson Medical Mall in the community room. I also shared that you'll be having a job fair tomorrow at the Metro Center main entrance and on the 15th at Hines Community College. Is there anything in particular people need to bring with them to the job fair?
Not exactly just what you would normally bring when you're applying for work, because there will be some interviews on the spot. So we would like for folks to already be ready, be prepared, that they will have the qualifying documents for such a thing. And then just like we said at the press conference, just your best self. Just be presentable, because our intake officers will be looking at that. It's not something to take lightly. It's a very serious thing. We want the best and the brightest, really, but we're giving everyone an opportunity. And so we would like to, when we take a profile or intake, we would like to give you the best marks possible. And when you do that, just come as nice as you can and presentable, and just represent yourself very well.
Thank you. Well, you know what? I wanted to learn more about BioCreek Global, so I'm a forever student. I'm a physician, and we stay in a learning mode, right? Because we want to stay
Yes.
on the cutting edge of what's going on. And I learned more about your company by visiting biocreekglobal.com. Yes, thanks, team, for putting that back up on the YouTube channel screen. I really appreciate that. But biocreekglobal.com. And there was a video there. Man, that video talked about this new block, EF block, this sustainable block that they're making out of recycled materials. Is that one of the type of jobs that you're going to be looking to hire people to do?
Yes, absolutely. We have machinery and equipment that's on its way to Jackson, Mississippi. Well, once the plant's built, we build the plant rapidly. We hope and we're planning to be in by May. All goes well with permitting, and so we would have individuals there that perform those duties to make that product for the main public globally, and also we'd be using it to build infrastructure, the new revitalization intended for the Metro Center. So people get to see firsthand how the block is manufactured and used in the general public.
Oh, I just love this. I'm so inspired by it. And thank you all so much for bringing this work to Jackson, our capital city of Mississippi. I know you're headquartered over in the ATL, isn't that right?
Yes, I joined the company. They were expanding the Atlanta area. It was EF Block, Georgia, and that's where it started for me just over 4 years ago. And so with that, I've been all over the world with it, about it, and we've just had a great opportunity to expand it. And so that's the idea. It will be Mississippi, Alabama, Georgia, South Carolina on the East Coast, so that we could sustain those jobs with lowering our costs and our logistics.
EF Block Mississippi sounds good to me. EF Block Jackson sounds even better. So you can go ahead and write that down. Listen, so you told me about the jobs that might involve actually creating these blocks, building these blocks, manufacturing these blocks. Listen, this is the literacy hour, and I tend to say things different ways because we want to be more literate. And when we practice and review various terminology, we all stay in the know. So please don't mind me when I say things differently, but I'm saying the same thing. So, what I want to ask you now is what are some of those other jobs? I mean, are you going to have like a receptionist or I don't know, what else happens at a construction site of this nature?
Oh, wonderful. Thank you for asking that. Yes, we don't want folks to be pigeonholed into simply thinking that it's just simply going to be manufacturing jobs. Our business model actually is it's an old model to take from the Japanese, where everyone in the company will learn almost everyone else's job. So we're talking about plant manufacturing, we're talking quality control, safety, we're talking about logistics, distribution. There's a host of jobs that if you're not mechanically inclined, there are a ton of jobs, and we'll have those posted here at the job site as well, job fair, sorry. And so it's just, you don't just think I'll be a plant manufacturer or mold technology, anything like that. It's going to incorporate everything.
Well,
Okay.
okay. Well, if people want to learn more, what number can they call if there is an information number available? What is
Well,
that number?
thank you. No, Doctor, thank you. We asked everyone to go to, but we're talking about cities, block.com, but we asked everyone to go Bio Creek Global, and
Okay.
in their contact information and numbers, we've been getting a lot of folks inquiring through that website and really uptick on Friday, as you can imagine. And so, and we are giving you feedback. We are responding to that. And so that's what we ask everyone to go to there. And there's, I think in that number, in that site is an 800 number, 188, I believe it is. But you would probably be in contact with December Rose. She handles all of that contact and she'll respond to you. And if that's something that we could do together going forward, she'll reach back out and there'll be an invitation.
I would love that. And I'm so glad that you all are here and you're providing jobs for Jacksonians
Okay.
and for anyone else who is interested. Everyone, that's Biocrete, the future of sustainable construction. Their job fair is this morning at the Jackson Medical Mall in the community room from 9:30 until 12:30 and tomorrow at the Metro Center. Yes, it's coming back online. Get there. Go to the main entrance tomorrow, 11 o'clock to 1 o'clock. And on the 15th, Hines Community College, the Megger Evers campus, 3925 Sunset Drive. That's 9:30 until 12:30 to on the 15th, which is Thursday. Bring that resume if you have one, dress to impress. And who knows, you just might land a job on the spot with Biocrete, the sustainable construction crew. Listen, sir, is there anything else you'd like to share with us before you leave?
No, I just want to thank you so much and thank you, Dr. Brother, my good brother Sherry Jones, and yourself, and thank the community for receiving us with such, oh my gosh, it's just been amazing since we announced it. And just want to thank the city and the county. This has been a great opportunity for us to be first of the many opportunities to be coming to Jackson behind this initiative. And we're just so grateful for that. That's all.
Well, you know what? Before you get out of here, looks like someone has sent us a note. Listen, we get them all kinds of ways, texting on, on our YouTube page, and sometimes people are not too shy. They'll call in. But someone is asking, what do the job pay start at? Okay, so what's the starting pay or salary or the wages of maybe your lowest paying job, sir?
Yeah, so our job's going to be uniform for manufacturing. That's primarily what this is for. Uh, those jobs in training, there's a $10 an hour training amount of wage for that, but we are pursuing raising that to 12.50, 12 an hour. After that, training has been completed, and you've got all those certifications that comes with that training. Then you move to our manufacturing job, and that will pay $19 an hour.
$19 an
That's
hour.
that's our base
Listen.
pay in the facility.
And do okay, I see it. Thank you all so much for sending. Listen, you guys are an amazing audience, but we're going to let him get out of here after this question. Okay, it's an excellent one, so keep them coming, and we'll connect you all with that website, the contact form, and I'm sure they'll respond to you that way as well. But I will go ahead and ask this one, not to put you on the spot, sir, but what are some of those benefits that you offer?
Well, we're right now we're teaming with an agency that's going to handle that for us, and we told them that we understand that we have a outstanding price point for our product, and it is in high demand. So we want the best package possible. We want our associates and team members not to have to look to go anywhere else to get anything better. We want to treat you right. We want to take care of you and your family, and then in return, you give us the best you have, and we'll have really good quality products hitting the market, and that's job security. And so we want to help protect that job security and give you everything you need in one spot. So we
Oh,
will have a comprehensive package that we're paying for right now to get put together, and that will be put together by the time the plant is up and we're moving in. Hopefully, like I said, right there in May and June.
thank you so much. Well, we're going to be following up. We'll keep up with you guys, and you're welcome to come back here anytime on the Literacy Hour. Thanks for calling in.
Yes, thank you for having me. Thank you.
All right, guys, you heard it. I love it. On the Literacy Hour, we learned about so many resources that can help us, and that's certainly one. So I want you to check it out. I've already given you that information. Let's see. I think I want to segue and talk about not only those NSAIDs today, that's very, very important, but the new nutrition guidelines. Yes, the United States has overhauled our dietary guidelines, elevating protein, whole milk, and red meats. Can you believe it? Believe it. The administration released new dietary guidelines that call for Americans to limit highly processed foods. Those high in added sugars and sodium, salt, that is, okay? And that they're endorsing products that had once been discouraged. Many nutritionists discouraged things like whole milk, foods like butter, and red meat. You've heard it. Stay away from that red meat. Well, the new dietary guidelines say don't stay away from the red meat. The new recommendations emphasize eating whole foods such as fruits and vegetables in their original forms, not processed forms. You want an apple? Go get the apple. You want an orange? Go get the orange. You want a carrot? Eat the carrot. And not processed or packaged or dried or whatever else kind of processing they may do to great fruits and vegetables. I love them, by the way. Foods rich in protein, foods rich in whole grains. That's what the new guidelines are recommending. They're calling for avoiding packaged, prepared, other ready to eat type foods. Yeah, we're getting back to cooking, putting some heat to the food and preparing it ourselves. They're asking us to avoid foods that are salty or sweet. Well, wait a minute, you're going to have a hard time with that one. Wait, hold on now. But that's what they're saying, and they're telling the truth. Listen, we'll be healthier if we get away from the salty and sweet foods, such as chips and candies and cookies, as well as staying away from sugar sweetened beverages like sodas, fruit drinks, energy drinks, and some artificial sweeteners. This is what I always say: everything in moderation. You don't want to overdo it anyway. We shouldn't be eating out every day. We shouldn't be drinking canned sodas every day, 2 and 3 times a day. It's wrong. It's bad for your health. In 2026, let's make better health decisions. Come on now. We're health literate. We can find information that pertains to our health. We can understand that information, and because we can find it and understand it, we can use it to lead healthier lives. The guidelines call for avoiding that packaged and that pre prepared, that ready to eat food. The new guidelines basically flipped the food pyramid on its head. They put steak, cheese, and whole milk near the top. We posted the flipped upside down pyramid on our social media. So go there and check it out. That's TT Solution LLC on Instagram and Facebook. You will find that we already have the pyramid there. It's upside down. Click that follow button while you're there too, and you will be able to keep up with what we got going on at Test Taking Solution. So again, and thank you guys in the back for doing that. Facebook and Instagram, TT Solution LLC is up there on the screen for those of you following us on our YouTube channel and listening to the live stream. All right, let's see. The guidelines don't stray that far, though, from mainstream nutrition advice. I want you to know that it's not like it's something foreign. The recommendations have always encouraged Americans to eat plenty of fruits and vegetables, and it stops short of explicitly saying that people should eat more saturated fats, but they're just not getting too far away from our current recommendations. But yep, that pyramid has flipped on its head. It's now upside down. It appears that the CDC Vaccine Committee may approve significant changes to the childhood vaccine schedule. Yep, there's been a lot of talk now. A few days ago, I know the New York Times, I know the Washington Post, our American Medical Association's website, lots of resources, reputable resources are reporting that CDC advisors are making consequential changes to the childhood vaccination schedule, delaying a shot that's routinely administered to newborns, and discussing big changes to when and how other childhood immunizations are given. The name of that committee is the Advisory Committee on Immunization Practices. It was handpicked by our health secretary, Robert F. Kennedy Jr., earlier this year. Well, they met recently here, and they decided that the vaccine to prevent hepatitis B should no longer be administered routinely at birth within 24 hours of birth if the mothers test negative for the virus. They're saying the children shouldn't get the vaccine. The infants, the newborns, they shouldn't get that vaccine. So, those are our guidelines, and we're expected to follow them. Pediatric cardiologist recently took over as chair of this influential vaccine panel. And there have been a lot of critics, though, of this birth dose of the hepatitis B vaccine. They say it's unnecessary to vaccinate all the children for the virus. Well, maybe the virus has been kept down because of the vaccination, right? I just say that the birth dose acts as a safety net. That's what I believe. As a family medicine doctor, I say that it gives infants immediate protection, okay, in case they acquire the infection from mothers, especially those who have an unknown infection status, okay? Sometimes infections are not immediately detected. Okay, one that comes to mind immediately is like HIV. So that's why, we recommend being tested. So this vaccine discussion is a highly contested one, but I just believe that the committee members are questioning the ingredients maybe that's in the vaccines, and there are some aluminum salts that are present in many childhood vaccines, and they're just trying to, I believe, make sure that the vaccines are safe. Well, these are old vaccines, and they've been given out for decades, right? We'll see. Stay tuned. As I learn more, I'm certainly going to share it with you. But right now, I think it's time for a public service announcement.
I get my flu shot because I have asthma, and anyone with an underlying medical condition like me has a much higher risk of getting really sick from the flu.
I get my flu shot to protect myself and my mom and dad. Because when you're older, getting the flu can be dangerous, even deadly.
I get my flu shot because it's easy, and I don't want to miss out on all the holiday fun with my friends.
Flu vaccination is recommended for everyone 6 months and older. Schedule yours today and learn more at lung.org.
This has been a public service announcement brought to you by the Test Taking Solution Foundation.
I get my flu shot.
Well, and so people are getting their flu shots, and I'm glad they are because that's going to help us keep down the contagious flu. Thank you for listening to those public service announcements that brought to you by the TT Solution Foundation. Listen, as we get to this final leg of our show this morning, I want to share with you some important bills that we are watching during the 2026 legislative session. Yes, the legislature is back in session. Legislators returned to the Capitol January the 6th and began work after swearing in its newest members, like Attorney Kamisha Mumford and Hattiesburg's Mayor Johnny Dupree, both now senators. The 2026 legislative session will end on April the 5th. On the first day, they passed bills that would provide teachers with a $2,000 pay increase and parents with school choice. And we'll tell you more about these on First Tuesday in February. That's when we explore education literacy, all things education related. So you'll hear more about those bills and how they're progressing at that time. Regarding healthcare, we're eagerly watching for bills that pertain to keeping Mississippians healthy. House Bill 374. Medicaid, expand eligibility on the Federal Affordable Care Act. It was sponsored by, or is being sponsored by, Representative Desmond Osborne. And Act to amend Section 4313-115 of the Mississippi Code. It says it's going to provide Medicaid coverage for individuals who are under 65 years of age, are not pregnant, are not entitled to or enrolled for Medicare benefits, and whose income is not more than 133% of the federal poverty level, as authorized under the Federal Patient Protection and Affordable Care Act, and for related purposes. It was referred to the House Medicaid Committee January the 9th. So they're over there discussing it perhaps at this time or when they get back to work. But that's where it is right now, the House Medicaid Committee. House Bill 252 and House Bill 256 are similar to House Bill 374, but those bills are sponsored by Representative Brian Clark. House Bill 123 is also similar. Talking about Medicaid expansion, you all, Representative Robert Johnson. House Bill 247, sponsored by Representative Brian Clark. And House Bill 224, sponsored by Representative Omeria Scott. All those have to do with Medicaid expansion. Senate Bill 2110, that's 2110, child neglect, creating crime related to the deprivation of necessary supervision. That is being sponsored by Senator Joey Fillingane to provide that if a parent, a legal guardian, or other person responsible for the child deprives that child of necessary supervision appropriate to the child's age, resulting in substantial harm to the child's physical, mental, or emotional health, that person may be sentenced to imprisonment. To provide for criminal penalties. That's the purpose of Senate Bill 2110. It was referred to the Senate Judiciary Division B Committee January the 9th. We'll be talking about Senate Bill 2099 on First Tuesday because that bill requires public schools to adopt policies prohibiting or restricting cell phone possession or use by students in class. That's being sponsored by Senator Briggs Hobson. Again, stay tuned to the Literacy Hour. Tune back in on First Tuesday in February. We'll talk more about that particular bill and let you know where it is in the process of becoming a law. Now, if a bill dies in the committees where it is currently, they're discussing it, and if it dies either on the schedule, they didn't bring it up for discussion, or maybe they discussed it and killed it. If it dies, you all, it does not become a law. So right now, these are just bills that we're watching. Senate Bill 2098, Days of Commemoration, designating June 19th as Juneteenth Freedom Day. It's sponsored by Senator Juan Barnett. The purpose of this bill is to designate June 19th as Juneteenth Freedom Day, to specifically provide that Juneteenth Freedom Day shall not be a legal holiday, but shall be a day of commemoration at no expense to the state. I want to clarify when a legal holiday will be celebrated, when the holiday falls on a Saturday or a Sunday. So that's the purpose of this Senate Bill 2098, and it's being referred to the Senate Rules Committee January the 9th. Now, House Bill 197, House Bill 200, both sponsored by Representative Omeria Scott, and House Bill 276, sponsored by Representative Brian Clark, also has to do with Juneteenth. House Bill 372, we're watching that one because, hey, one reason people don't get health care is because they can't afford it. They can't access it. And so I'm excited that House Bill 372 talks about employment, giving people an opportunity to work. And it's going to prohibit denying solely because a person has been convicted of a felony their employment. Thank you, Representative Solomon Osborne. So he has sponsored this bill, House Bill 372, to provide that no person shall be denied employment solely because he or she has been convicted of a felony. Listen, they've done the time and they've served their sentence. Come on now, let's let Mississippians get up. That one has been referred to House Business and Commerce Committee. House Bill 313, International Physicians, authorizing Mississippi license for certain physicians who are sponsored by an in-state healthcare provider. That's being sponsored by Representative Sam Creekmore. Um, House Bill 70, being sponsored by Representative John Hines, Small Business Bridge Loan Program. I like the sound of that. An act to establish the Small Business Bridge Loan Program in the Mississippi Department of Banking and Consumer Finance to provide short-term bridge loans to small business owners for the purpose of providing financial assistance until the owners are able to secure other financing. I like that. House Bill 35. Now, this is interesting. I heard this program talked about at during one of the legislative hearings on maternal health and infant mortality. But House Bill 35, it's RX Kids program to create a provide time limited assistance to pregnant women during pregnancy and for 12 months after birth. It's being sponsored by Representative Omeria Scott, an act to create the Mississippi RX Kids program. It's a pilot program. It's going to provide targeted, time limited economic assistance, money, you all, to all pregnant women in those counties experiencing an acute economic hardship during their pregnancy and 12 months after giving birth. Yep, that's House Bill 35. Stay tuned. We'll be talking more about that bill. And House Bill 212. I love this House bill as well because this House bill looks at making an appropriation to the State Department of Health for the purpose of providing funding for federally qualified health centers in the state for the fiscal year 2027. Now, I was under the impression that the Mississippi State Department of Health already provides funding, which is great, but this is for them to provide funding for 2027. The Mississippi Qualified Health Center Grant Program provides funding to Mississippi's 21 federally qualified health centers. I told you that our health centers would make a great medical home for those of you in need. Why? They address health disparities. They provide access to primary and primary care and all the other types of care I mentioned here earlier for uninsured, underinsured, and medically indigent patients in Mississippi. We're going to be talking a whole lot more about federally qualified health centers because I just believe that they are the answer to a lot of our healthcare woes here in Mississippi. Thank you so much for tuning in today to the Literacy Hour. I hope you found the information helpful. So much more to share. But join me next Tuesday, third Tuesday, when we will talk about financial literacy. You know, I'm going to share some very helpful community resources. If you'd like to be a guest on the show anytime, just call our foundation 601-714-8378. Have a great rest of your day, everyone. Be safe. For the past 1 hour, you have been listening to the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, M.B.A. We are located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Visit us on the web at www.testtakingsolution.com. Join us each Tuesday from 7 to 8 a.m. for another life-changing conversation here on our podcast live stream at affiliate stations.
A long time coming, but I know a change gonna come.